Well, hello, everybody, and welcome to National Nurse Practitioner Week. I am Dr. Heather Schlosser. I'm a family nurse practitioner and a psychiatric nurse practitioner. I am an assistant professor at Frontier Nursing University, and I'm also the interim program director for the Psychiatric Mental Health Program. And I have the immense privilege of being on this panel tonight and moderating a conversation talking about expanding scope of practice with three amazing women who are all in the process of expanding their scope of practice. So I am going to introduce each one, and then we're going to ask a few questions about expanding scope, where they're at with that, why they're doing it, and any advice that they have for you. So I am going to start with Ximena Rosado Bennett. If you can just give us a little wave, Ximena.
Hi.
And Ximena is a native of Argentina. She began her career in women's health as a childbirth educator and labor support doula in 1999 after the birth of her son. In 2007, she graduated with an associate degree in nursing from Phillips Beth Israel School of Nursing in New York and obtained her RN license. She later completed her Master's of Science in Nursing as a family nurse practitioner from Frontier Nursing University. She took advantage of the ADN to MSN Bridge program, which is how she became a family nurse practitioner. She's worked in various settings, including the emergency room, intensive care unit, hospice, and is a New York State certified sexual assault forensic examiner. She is currently pursuing a postmaster's certificate in midwifery from Frontier Nursing University. She and her husband have a son and a daughter, and they live in New York. And we're very pleased to have her on our board today to talk about her current process of expanding her role from being a family nurse practitioner to adding certified nurse midwifery.
Yeah, thank you so much for inviting me.
Of course. And next, we're going to talk about Fawn Workman. Fawn, can you give us a little hello?
Hi.
Fawn became a registered nurse in an associate degree nursing program when she was at the ripe old age of 20. She later completed her Bachelor's of Science in Nursing with a minor in psychology at Liberty University and graduated from Frontier Nursing University's Master's of Science Nursing Family Nurse Practitioner program. Her nursing career is also vast and has included cardiology, medical surgical nursing, which she also holds a board certification in. She's worked in multi-hospital float team nursing. She has several years experience as a retinal ophthalmology registered nurse and retinal photographer. Her current nurse practitioner position is in a hospital managed retail health clinic, and she also recently began part-time work as adjunct faculty at South University's Family Nurse Practitioner program in Virginia Beach. She has additionally, with all of her leftover time, has started an LLC to provide care in a family practitioner part-time position to expand utilization of her advanced practice registered nursing skill set. Fawn is also going to be joining our inaugural family psychiatric mental health nurse practitioner program at Frontier Nursing University. So we're very excited about that. She lives in Chesapeake, Virginia with her daughter, who is also exploring becoming a psychiatric nurse practitioner. She does a lot of volunteer activities, including medical mission trips to Jamaica and Haiti. She works at a free clinic and is part of the Virginia Medical Reserve Corps. She attends church and community activities in her free time, which I can't imagine she has a whole lot of, and also is a longtime member of Frontier Nursing University's Pride program. So thank you for joining us, Fawn.
Thank you.
And we have Nicole Mutnansky. Can you give us a little hello, Nicole?
Hi.
Welcome. So Nicole also graduated with an associate's degree in nursing, and she also completed her Bachelor's of Science in Nursing at Carlow University. Her path to midwifery and women's health started as a Bachelor's of Science nurse at Carlow University when she shadowed a midwife for a day at a local birth center where she now works. Nicole went on to pursue her master's in nurse midwifery and her postmaster's as a women's health nurse practitioner from Frontier Nursing University. Nicole has previous experience as a psychiatric nurse working at a state psychiatric hospital with women who suffer from personality disorders. She has also worked for the Pennsylvania Department of Health as a community health nurse and as a registered nurse and birthing assistant at the Midwife Center for Birth and Women's Health. She is also working as an office-only certified nurse midwife. She's very active in her community, like the rest of our panel. Not sure how you all do all of these things. She recently helped open the Three Rivers Mother's Milk Bank, the first nonprofit human donor milk bank in Pennsylvania, where she now sits on the board of directors. She also enjoys spending time with her family and creating new adventures with her 3 children, who are 7, 4, and 2. She's very excited to also be a member of the Frontier Nursing University's Psychiatric Nurse Practitioner inaugural class, which we are all very excited about. So thank you all for joining us on Nurse Practitioner Week and talking with us about your adventures. You've done so many things, and we're excited to hear about why it is that you wanted to expand your role and move into other subspecialties. So I'm going to start with Ximenas, who is a family nurse practitioner and is also currently enrolled in a certified nurse midwifery program. So my question is, what made you decide to expand your family nurse practitioner role into midwifery and add that to your practice?
Well, it was actually a little bit inspired by Frontier's history. And initially I went into nursing with always the goal to become a midwife. But as I started looking into educational opportunities and sort of expanding my knowledge of nursing in general, I realized that the family nurse practitioner was a great sort of launching pad for to incorporate other care, other parts of care into it. So I decided to start with family. I thought it would give me enough of a wide enough knowledge base, and then midwifery is sort of my specialty. But women's health has always been my focus. And I just really, it's almost what I did with nursing. I thought I started with emergency because that would give me a broad overview of things and then go into other areas. And I feel that family nurse practitioner sort of gives me the same broad knowledge base and ability to care for everybody in the family. And I just can't, see separating a pregnant woman from her family. So having the opportunity to treat the unit is really what drove me to it.
Fantastic. That's an excellent reason to have that really comprehensive integrated approach to family care, and making it really family centered is so important. And you're right, so much part of our history at Frontier. So that's fantastic. And how do you envision midwifery when you finish up the program fitting into your family nurse practitioner practice?
Yes, it's a little strange because there aren't, there actually are quite a few CNMs who are family nurse practitioners, but integrating it into practice is not so common. So it's not like I'll find a job where they're asking for an FNP who is also a CNM, which would be great. But eventually I'd like to have my own practice. I have a couple of friends who are also in this journey. One is also an FNP and doing her midwifery degree right now, and another 2 or 3 that are midwives. So eventually our dream would be to actually open a birthing center that was really a family care center and be able to give care to the entire family. That's the dream. So we'll see when that happens, but that's what we're working towards.
That's fantastic. Thank you. And Nicole, you are a certified nurse midwife and a women's health nurse practitioner, and you're getting ready to start your journey in the psychiatric mental health nurse practitioner program. And what made you decide that you wanted to expand into psychiatry and integrate that into your current roles as a midwife and a women's health nurse practitioner?
Well, I started my nursing career in psychiatric nursing, and I've always been drawn to mental health. I'm expanding my current role as a midwife now, really to be able to provide care to women who are experiencing mental health issues that are related to life events that are unique to women. So like pregnancy, postpartum. It wasn't really until I was in my midwifery clinical that I realized just how many women are dealing with OCD, anxiety, depression, bipolar disorder during pregnancy and postpartum. And, as a midwife or someone who works in women's health in general, I think we become so invested emotionally to our patients. And it was really hard for me personally to be able to provide all this care and support for women's pregnancy as far as her physical health went. But when it came to her mental health, I had to give her referral.
Right.
And we can only go so far. And it's a shame, especially after you've already established this trusting therapeutic relationship with that woman. It's sad. And half of the women won't even seek the treatment anyway. So I really want to be that provider who has the clinical skill and the understanding to help meet the needs of those women and provide them with the education and support and treatment that they need. And when I found out that FNU was starting this program, it just, it really made sense that this would be my next step.
Great. I love that. And it's so true, having to strive to get people into services. And for people that are in traumatic events, having to retell their story can be really, really difficult. And when you already have that therapeutic relationship, it's so nice that your expanded scope can allow you to provide that care as well. So that's really exciting. It's going to be great for your community. And you spoke a little bit to this, but can you expand on your thoughts on what excites you the most about starting the psychiatric NP program?
So I'm a recent graduate, and when I was in Hayden for graduation, everyone was so excited about the program. Even my RCF told me, she was like, there are so many faculty members that are really even interested in this program as well. And it just seems, like everyone is excited and they are really looking forward to the program. And I think, the thought of finding another school, it was really kind of what was holding me back from wanting to do this. Mm-hmm. And, now that I get to continue on with FNU, I mean, the community here and the relationships that I've built, I think it's very hard to come by, especially when you're in a distance education program. And I've always felt really supported here. So I'm, really glad that I can continue on, for something that I'm passionate about with the school that I started with. So I think that's what makes me most excited.
Great. Thank you. Well, we're excited to have you. All right, fun. So you're a family nurse practitioner and getting ready to also enter the psychiatric mental health nurse practitioner program. And how do you in particular envision expanding your scope of practice, your role, your current family nurse practitioner practice by adding in psychiatric care?
Well, I have been undecided, and I think it'll be clear as I go through the program whether I will focus more on having a family nurse practitioner in a medical sense with enhancement with the psychiatric mental health nurse practitioner skills and knowledge, or if it will switch to psychiatric mental health nurse practitioner practice with the enhancement of having the background of a family nurse practitioner. So either way, it's a benefit to the patients and to myself to, have the extra knowledge and be able to incorporate that. As Ximena and Nicole both said, you can't separate the patients that are birthing from the rest of the family. You can't separate, the family from the patient. And so having, I said this when I was a floor nurse on med-surg, and I would float to different units. And I would go to the psych unit inpatient, and I would have just as much psychiatric mental health out on the med-surg floors, because it does not stay just in its own little world. It affects patients across the spectrum, from mild to severe, from those who've learned how to cope or need new medication or need therapy. It can't be boxed in, and so having both practices together is important for the care of the whole family and the whole patient.
Yeah, I agree. And I think that you made a good point in that when we expand our scope into other subspecialties, it doesn't mean that we're abandoning our roots or our initial specialty. So, merging things like family nurse practitioner with midwifery or with women's health or with psychiatric nurse practitioners, it can be an integrated practice. It doesn't mean that when we add or expand our scope that we're leaving our current community that we're serving. So that's a really good point to make sure that people are all taking into account, because sometimes that's scary when other people hear that nurse practitioners are moving from one discipline to another. They're fearful that we're losing those NPs from their current practice, when really many times people expand their scope simply to expand within the community they're already in and within the practice they're already in. So that's great. Well, it'll be interesting to see how your adventure goes through the program. And how do you feel like, and you touched on this a little bit, but how do you feel like you combining your family nurse practitioner practice with your psychiatric NP practice will help your community?
I am sorry, there's feedback.
Okay.
Being able to work with the patient and have the background of understanding both is going to be helpful. It also means that I can go to different communities that may not have had either a psych NP or they may be needing a family nurse practitioner. But it allows mobility for me to reach into rural areas, even things like, medically disadvantaged areas in my local large urban community we have plenty of medical providers, but we do not have enough PMH and Ps, enough mental health providers in the area. So just being able to expand and be able to go to either place or having a setup where we could do both. That's not out of the question to have a practice that incorporates everything, just like they were speaking on before.
Yeah, great, thank you. So I have one last question for each of you. I'll start with Ximena. If you had one piece of advice for an advanced practice registered nurse who is considering expanding her role into a subspecialty, what would that piece of advice be?
Well, I think just to do it, don't be scared, and but really to think about yourself as a provider and where you fit, what kind of work you'd like to do, and what other specialties might bring to it. I'm really excited about the Psych NP program at Frontier, but I think it fits perfectly with midwifery, with women's health, family nurse practitioner. It's just such a great combination to have that other piece of knowledge that will help you treat the whole person. I mean, that's really where we need to get to be able to provide preventive care, primary care, and treat the whole person, which also includes the family, the community, at large. So don't limit yourself maybe by starting with a specialty, think of it as a global issue and what you'd like to do with your future.
Excellent advice, thank you. And Nicole, what are your thoughts on that? What would you give for advice?
I think to touch on that a little bit, my advice would be pretty similar. When I told my coworkers or other providers or recent classmates that I was going back, a lot of them looked at me like, we just graduated. And a lot of them said, that my coworkers said they had considered going back, but they just didn't think that they could do it. They were too comfortable in their own specialty. And I think, don't be afraid to go out of your comfort zone. If it's something you really want to do, don't put it off, just go for it. Because I think the more time passes, the less likely you are to do it. And why not broaden your knowledge base? Just set short-term goals to help you reach your long-term goals.
Excellent advice. Thank you so much. And Fawn, your thoughts on advice for somebody looking to expand into another discipline or expand their scope?
I would say do your research. Find out why you are wanting to go back and make sure it matches your skill set, what you want to do, just like they said, but also do your research on the school. There's many programs popping up, but not all of them are going to have the same caliber. Not all of them are going to have the same rigorous studies that you will need to be successful and give your patients the best care.
Yeah, agreed. That is all excellent advice. And I would add to that, looking into what your community needs are. So what are you going to be able to really contribute and give back to your community that you envision staying in and working with? So all phenomenal advice. Thank you so much. And I'm so excited for all of you to be expanding your roles and bringing that back to your communities. Your patients and families are going to be so lucky to have you all there. So thank you. Is there anything anybody would like to add before we wrap up this evening?
I'm excited.
Yeah,
Good.
it's very exciting. It's very
See you
exciting to reach
December,
your
Fawn.
goals, so that's something to always go for.
Absolutely, agreed. Well, thank you all for joining the Nurse Practitioner Week Expanding Your Role panel. We appreciate it, and have a nice, restful evening.
Thank you.
Thank you.
Thank you.
Bye.